Dear friends, I just thought I'll do this video quickly about how this COVID virus spread across the country and what measures that India could take in advance so that they don't have to go through the same thing that the other countries are going through. My name is Tippeswamy Bilahali. I'm a nurse working in London. So I just thought I'll share my experience and the role of various personals. So going back to the background of COVID-19. So as you all know, it originated from China in around December time and January, followed by for the Chinese New Year, everybody traveled from Italy to China, and Wuhan was the city where there was an outbreak happened, and Chinese New Year was cancelled, and they all went back to Italy. In northern Italy, there is a huge textile industry where there's a lot of Chinese residents are there, and apparently one of the northern Italian city the mayor launched a campaign of Hug a Chinese. So that's where the virus spread around Italy, and it became outbreak in Italy. It became an endemic thing in Italy. When around February time, during this outbreak in Italy, most of the European country travelers went for skiing holidays to Italy, and then they carried the virus and they brought back to their own countries, and that's how it's become now almost pandemic. Well, it is pandemic now in across most countries now. So that's the background. So where are we in terms of India? India, so very limited number of people. It's good that the India's sealed the borders fairly early. That's a good move from Prime Minister of India, which World Health Organization also thought it was a brilliant initiation from the Prime Minister. So that's why there was not much of an outbreak in India so far. But my worry is UK is 2 weeks behind Italy, and India is about 5 weeks behind UK. So all in about 7 weeks time. So I know the curfew is imposed for 3 weeks at the moment in India. However, my concern is that it may not be enough, because you might not see the impact for another 5 weeks. So what I suggest, these are some of the things that I can think of. For my advice to the politicians would be impose strict isolation and probably review it in 3 weeks time once again. And please, because you guys are the policymakers and decision makers, so you guys need to minimize your travel and try and do it as much as possible from your own office or home, and minimize your staff contact as well, because you are needed to make those decisions. And third thing is provide enough funds for the frontline staff, medical staff, technical staff, labs and nursing staff. The funds are needed now to get those resources if possible, and try and import those resources as much as you can and be prepared. To my media friends, I suggest is, please do not travel around the cities. Try and use the web facilities that is available now. There is a lot of social media facilities are available. You can interview people over the phone, video conference call, and invite a panel of experts who can give advice to public, and keep on repeating those messages to the public, so they can isolate themselves. They can self-sustain in their own houses. Please reiterate that they should limit their travel outside if unnecessarily. And the role of the public, strict self-distancing should be maintained. Otherwise, it is going to be a difficult once it becomes a pandemic thing. Once in India, it's going to be really difficult to control it. So please self-isolate. If you have one or more than one room, sleep in different rooms. Maintain that distance of at least 2 meters between between the family members. Um, and help for shopping for elderly people if possible, or if there's anybody who's got other health issues. um, and stock up items for at least 2 to 3 months, so though you don't have to go out of the house as much as possible. And please do not tie those scarves or stuff like that, even if you do, but please make sure you do not take it off and put it back on again, because you're likely to carry the virus on the outskirts of it, and then if you put it back, you never know whether you inhaled the bacteria already. So it is important, if you wear it, you make sure you do not take it out and then put it back on again. You keep it all the time, and as soon as you come out, you just wash it. That is important thing. And the medical role, the manufacturers, you need to find a way of manufacturing some face masks and goggles, because the route of entry is mouth, nose and eyes. We know that, yeah. So please make sure you try and find a solution for this as soon as possible. We know it's going to be out of stock in any of the countries. The manufacturers they just don't have enough resources to manufacture it. You have to find your own way of manufacturing these items locally and find those innovative ideas. Medical role, this is my expert area, so I would like to elaborate a bit more on this one. India has got a large volume of medical and paramedical professionals. That includes nurses, physiotherapists, pharmacists, dentists, and you name it. So why don't we use these facilities, you use these resources? So make sure you set up a center where people can, even if they want to work from home, it is absolutely fine. Record their phone numbers. If anybody wants to inquire about the illness, please ask the patients not to come into the hospital. Instead, let them call a central number, and then the number is passed on to a person, and then they will contact the patient over the phone and give expert and standard advice. And for the expert, it has to be, the message has to be standard guidelines, and that has to be designed by the public health team in India, and the panel of microbiologists in consultation with the panel of microbiologists. And then one is a telephone clinic. Ask the patients to avoid coming to the hospital. No routine appointments should be done. Please avoid any aerosol procedures if possible, because that's likely to spread the infection. Avoid the venturi mask, because air is likely to leak. And then the other thing that you can do is cancel all the routine procedures as much as possible. And especially the immunocompromised patients are really affected. So you need to be considerate about those patients. Also, the other thing that you must not forget is the patients who are non-COVID, but they are scared. They also need to be addressed as well. If they have chest pain, for example, if they have a stroke, they need to be addressed. So you have to have separate facilities for treating patients with non-COVID infection. Here, the private sector needs to take that responsibility, because as we know, India, 80% of the healthcare resources are private sector, and the public sector is unable to cope with these kind of things. So hope you find this video very helpful, and please do take this message and share it with your friends as much as possible. Thank you.